I'll start introducing. So welcome to the third webinar, Nursing Research, Making It Happen. We're very happy to have Professor Anthony Staines with us today from DCU. Anthony's Professor of Health Systems, School of Nursing, Psychotherapy and Community Health in DCU. Thank you for joining us today, Anthony, and I let the floor open to you and we'll go through with the housekeeping. You're going to mute everybody, aren't you there? I think we'll be muting everybody. We're going to do a series. We have sent out the paper, the RCT, random controlled, which is a multifactorial intervention for the prevention of falls in a psychogeriatric nursing home patterns. Was it? Okay, my writing. So it's an RCT. So what we're going to do, I'm going to hand over to Anthony. We're going to talk about the article and critiquing quantitative research. And we're going to do a series of breakout rooms. I'm going to have a break about 2:45, comfort break for a cup of coffee, whatever, and return about 3 o'clock. Is that okay, Anthony? So I hand over to you. Okay. Enjoy, everybody. Thank you.
Thank you very much, Sharon. Much appreciated.
Thank you.
Okay, so I'm Anthony Staines. My professional background is pediatrics and public health, essentially, and I'm an academic epidemiologist for the last 30-something years. So when Kate asked me to do this, we had a conversation about what was a good approach, and she suggested to pick a single study and go through it. And we picked this one because the connection, the importance for nursing, I think is fairly clear. Falls are an incredibly important cause of morbidity. They're one of the major reasons for traumatic brain injury, which is another of my research interests. And it's exactly the kind of study, and I think this is a good quality study, that you will come across when you're reading the literature and trying to design your own research activities. So you may have less interest in falls prevention than my cat does. That's fine. This is not we're not going to talk about falls prevention. We're going to talk about randomized controlled trials. We're going to talk about what they are, a bit about their limitations, and we're going to go through how we go about interpreting them and making sense of them. So, first of all, has everybody read the paper?
Yes.
Okay. I seem to be hearing myself twice for some reason. This is exactly what you might find if you were using, if this was a question of interest to you and you used PubMed and you said, well, I want to look at the literature on falls prevention in nursing homes. This is exactly the kind of thing that would come up somewhere on the list. I'm not going to talk about using the PubMed. I'm not going to talk about using the various search tools that are available. CINAHL has a lot more of the nursing literature than PubMed, but PubMed is vastly more comprehensive than CINAHL. It covers a much, much wider range of topics, and you need to be familiar with both. So you need to be happy enough finding information. Often the most effective way to find information is to find that paper, read it, and look at the articles referenced in that paper. But you need to be able to use the tools as well. So what does this paper tell us? It says it is multifactorial intervention, and you're thinking, what is that? And it's a randomized controlled trial, and you might ask, what is that? Multifactorial intervention is just one that has lots of bits. And very often in practice, real interventions have lots of bits. We have this kind of intellectual model in our heads of clinical trials, that it's a drug versus no drug. Real clinical trials are almost never a drug versus no drug, because there's almost always a drug that does something for whatever it is you're studying. So real clinical trials of drugs are often this drug versus that drug in a common care context. Nursing tends to be more interested in the common care context, which is where the multifactorial intervention comes in. So this is a fairly common pattern for a nursing study that there's a problem, you want to change it, you want to change 5 or 6 things at the same time, which you hope will have an impact on some desired outcome. So there's, for example, there are multifactorial studies of preventing errors in the dispensing of medicines in hospital wards. There are multifactorial trials on the prevention of errors in detecting sepsis in hospitals. There are multifactorial trials for prevention of errors in the detection of postoperative hemorrhage in surgical patients in hospitals, all of them directed to nursing practice. What are the limits of randomized controlled trials? Can someone think of something that would be really hard to test in a randomized controlled trial? You need to unmute yourself to say it or put it in the chat. Yeah, so I can see the chat. Can someone type something in the chat that they think would be hard to study in randomized controlled trial?
Okay, so mine, I don't know if this is okay, is how to measure the fear of people who are near death. You know, that kind of measure, psychological fear of death, how to measure that.
Yeah.
That'd be a good one?
That's a really good one.
Okay.
And the point there is twofold. The first is this is highly individualized.
Yeah.
And the second is not an intervention.
Mm-hmm.
So measuring something is not an appropriate approach for a clinical trial. You can do a trial which compares 2 methods of measuring something. So if you have a method, you can check another method against it. And the whole literature on measurement comparison studies. But I'll give you an example of a real study that's almost impossible to do as a clinical trial. We're doing a wedge-controlled, randomized controlled trial of the use of technology to support frail elderly people with cancer. So there's actually a clinical trial going on. And my group's job is to study how is that being made to happen? How is it being implemented? And actually, that doesn't make any sense as a clinical trial because it's completely tied. The implementation is completely tied to the context. And there's a lot of stuff that's completely tied to context that is not particularly well suited for clinical trial. And a lot of stuff in implementation is really hard to study in a clinical trial setting. And there's a load of work, and I'm just going to point you to one author. And I'm going to type her name because it's not at all obvious from her pronunciation how it's spelled. This woman, Tricia Greenhall, has done a lot of work on exactly this question. So if you're interested in limits to clinical trials, she's worth looking at. She's taken a very systematic approach to thinking about it, thinking about what are the challenges, and her focus is on things that change practice.
Anthony, sorry to interrupt. One of the nurses has come in, Michigay Rotia, to say lack of generalizability in a study. Is that a good point? Yeah. That's
a challenge for any study.
Yeah.
Because any study you do in a context. So if we look at this study again, one of the things you always ask yourself about a study is, what is the context? Where was this study done? And they tell us. The study was done in 12 nursing homes in the Netherlands, in psychogeriatric wards, or what they describe as psychogeriatric wards. So there's your context. Does that apply in an acute hospital?
Yeah, actually, I cannot see that screen. It's very blurred.
Okay.
Thank you.
Okay, I'm not sure what was going on there, so apologies.
Yeah. We can see that now. Thank you.
That's where it's done.
Okay.
And can you generalize that to other settings is the question. It's a very specific group of patients. It's a very specific type of setting. It's a very specific set of needs. Does the same thing apply? Would this work in an acute hospital? Would this work in people living at home? Would this work in a lower intensity setting in a nursing home? The answer to those questions will probably have some impact, but we don't know. So you've always got a challenge with generalizability. But there's a whole range of other challenges with RCTs. And part of what you need to be able to do is to read an RCT like this. I acknowledge that there's no such thing as a perfect trial. There are some really, really good trials. This is a good trial, I think, not a really good trial, but it's not a bad trial. There's an awful lot of trials which are inferior, which are so badly done, they tell you nothing. And you know, why did anyone bother doing it? Why are you bothering to read it? Good questions. So this is a kind of more typical, pretty good trial, but it's not perfect. It's not beyond criticism. And you need to understand some of the basic ideas. So are people happy with what a randomized controlled trial is? So what does cluster randomization mean? Cluster randomization is really common in practice-based trials. And if you think of the logic of it, I know some of you have hospital backgrounds. So if I want to change something in a hospital, there's two fairly obvious levels at which I can change something. I can change something at the level of the whole organization. So I can make a change at hospital level, or I can make a change at one of the units of the organization. And for typical Irish hospitals, those units are things like wards or operating theatres. We have a PhD student who's got her PhD the last few weeks, and her intervention study was done in different operating theatres in Beaumont. It wasn't a randomized trial, but her unit of work was the operating theatre. In other cases, you might use the ward. In this case, they use nursing homes. And all the cluster randomized stuff means is that everybody in the ward gets the new whatever it is. So if you brought in a new pattern for doing clinical observations in a ward, supposing you wanted to test doing pain scores as opposed to not doing pain scores, you could randomize patients individually to receive or not receive pain assessments, but it'd be a lot easier to randomize the whole ward. So this ward does it, that ward doesn't do it. That's all that cluster randomization means. So you've got a method which is slightly challenging, because what cluster randomization does is it reduces the number of people. So this is a study of 518 people, but they're actually in a lot fewer than 518 blocks. So you didn't randomly allocate 518 people, half to receive the new intervention, half not. You randomized wards, and some wards got the new intervention and some did not. And you're comparing wards. And that gives you an actual sample size, which is somewhere between 518, which is the number of people, and I think 24 or 26, I should know this, was the number of wards. So the sample size is somewhere between these two things. Yeah, 12 wards. So the sample size is somewhere between 12 and 518. And you're hoping it'll be closer to 518 than 12. Because if it's 12, you can go home. You haven't enough people to study. If it's 518, you probably have enough people to study. So when I look at an abstract like this, one of the things I look for is what's the size is big enough. And the commonest failing of clinical trials is they're too small. You frequently see clinical trials with 100 people enrolled. And unless you're studying something extraordinarily rare, there's no point. You know, enrolling 100 people in a clinical trial is not helpful. Doesn't tell you anything. So this is a decent sized study. So are you clear about the question the study is asking? So what I want you to do, I'm going to put you into breakout rooms now. It's 2:20 now. I'm going to bring you back out at 2:25. And I want you to discuss in your breakouts, are you clear what the question in the study is?